think it was 2013 when all of the specialists were being required to also complete, there's a lot of regulations.
How do you guys keep up with the changes?
We have a compliance administrative assistant who keeps track of all of the...
What excites you more about the future of healthcare?
I would like to see our relationships with providers get stronger and for them to understand more about...
As a woman in healthcare, are there any unique challenges?
I really want to help women support women.
Welcome to today's episode. Before introducing today's guest, just a reminder to follow S2M Health on LinkedIn to discover new episodes in your feed. We have many episodes with healthcare leaders, professionals in the healthcare space, a lot to learn from this very amazing industry. Today, I'm thrilled to have Jacie Jeffery with us, a dedicated healthcare leader and current quality manager at Hometown Health in Nevada. With a strong foundation in quality management and patient care, Jacie has spent years ensuring that healthcare systems serve patients and communities effectively. Today, we talk about her journey in healthcare, uncover her perspectives on quality management, and hear about her unique experiences in Nevada's healthcare landscape. Thank you, Jacie, for joining us and sharing your story today.
You're welcome. I'm happy to be here.
So happy to have you here. We met in Vegas, right, at the conference, at a HEDIS conference, and you were in a session, and I thought you had a great background. So I'm glad that we're having a conversation today. So Jacie, how did you get started in healthcare? I'm always fascinated how we all have a very not very straightforward path to what we do today. So I want to know, how did you get started?
So I actually got started in healthcare in 1995. I was originally in banking, of all things. And so my dad was very ill. He had end-stage renal disease. His healthcare was very disjointed and confusing for him. And he ended up passing away, but he just sort of gave up once he found out his diagnosis and had to have dialysis. And he went to an integrated health system that basically said he wasn't a candidate for a kidney transplant. And turns out he might have been. He went to a different health plan after that. And so it was just really disheartening. And I wished that I could have helped him in that journey. And so I just really became interested in healthcare. So I actually became a medical assistant first. And I worked at a family medicine residency for 10 years, teaching new family medicine doctors. And so I just really enjoyed that and learned a ton.
Is this in Nevada?
No, this was in Idaho. I was in Idaho at the time.
Oh, awesome.
Yeah. And so it really gave me a unique perspective on physicians and how they learn and how they understand things, because it was a training environment and I was like baked into it for 10 years. So I have a comfort level with providers and talking to them and being able to explain things to them in a way that they understand and don't feel like they're being pressured into doing something that they don't agree with. So I enjoy doing that.
Yeah, it's a skill.
Yeah.
It's a valuable skill. Yeah, awesome. So you were doing that for how long? You were on that side for how long?
So I was I've actually just been on the health plan side for almost 3 years. I was on the provider side. I've had a lot of different hats as a nurse. Nursing is a very broad field. It's not just at the bedside. I wasn't really interested in being at the bedside. I was in my 40s when I got my RN. I didn't want to work nights. I had a lot of background knowledge in different things that I used to my advantage. So I actually became a clinical informaticist and was in informatics for 3 years and worked with
What does that mean, Jacie?
So it's an informaticist is kind of a liaison or a go between IT and clinical environments.
Wow.
So it's a person that has their foot in both worlds, and can explain what IT is trying to do to the providers or end users of that program.
Mhm.
And we also can build things in the way that like an EMR can take it in, but also kind of fulfilling that provider's vision for what they want in the EMR.
You were on the data side. How did you gain that skill set to be?
Well, I was just kind of sink or swim.
I was there. So
I worked at a small GI office, and they needed a new EMR. Because that was the time, I think it was 2013, when all of the specialists were being required to also complete preventative screenings or care gap, fill care gaps. And so there were a lot of measures. At the time, we called it meaningful use. It's now called MIPS. And so we were heavily into building that new EMR out to what we needed, to our specifications. And it was me and my partner, who I actually still work with. We've kind of followed each other around the area. And we just had to build that new EMR system up to what they needed at that GI office. So we were in the thick of that, working in that EMR, building notes, and they called them ribbons, and there's all sorts of like lingo I won't go into, but we just basically had to build that from not quite scratch, but almost.
Wow.
Yeah.
That's very bold.
Everybody.
So as a nurse, like I think a lot of people don't realize how much knowledge is required also on the patient side, like of actually knowing diagnosis, knowing the medical terminology to be able to design systems, right? Like,
and the regulations, there's a lot of regulations, and they're very different between inpatient and outpatient environments. And then obviously between health systems and health plans. So it's a lot of different information, but it all meshes together. It all works together. And so once you are in it and can make sense of things, you'll recognize similarities between the different regulation. I don't know. I don't know what the word is I'm looking for. Sorry. Well, regulation provider.
Yeah, let's move on from that. So I have a question now about that transition from this world and the health plan world. So how do you transition to a health plan, and was it an easy transition for you?
No, it wasn't real easy. When I came on, there was a big change in senior leadership. And so my senior leader was taking on a whole other department that she was unfamiliar with. So I didn't really have her to guide me. And there's just so much interpretation that goes into like the HEDIS technical specifications and the rules for CMS when you have a Medicare Advantage program, and compliance and things I didn't really have my hands in the healthcare industry. I knew about like Joint Commission, I knew about ACO, I knew about those things, but the compliance piece of it I wasn't really involved in. I basically did what I was told, and then, but now, having been in the position for almost 3 years, I still feel like, well, every year something changes with a health plan. So every year something changes with HEDIS. And it's just a constant learning curve and becoming familiar with those measures.
Right.
And just staying on top of them. Some of them stay the same, which is nice, but some of them change significantly. So it's just a matter of keeping abreast of everything.
Yeah, I mean, me on the vendor side, right? So I try to learn as much as I can about the industry in terms of like in depth, right? Measures, um, the rulings, every year, like you say, things change. So
Mhm.
I'm always wondering, like, I don't necessarily need to know because I'm not actually running the programs. Like, if I was quality manager, like you are, obviously, I will have to know all of it
Mhm.
inside and out and every year be aware of the changes. But I'm not, but I'm always wondering, how do you guys keep up with the changes? Like, how did you learn? Is there like a special uh, communication that goes into your inbox that from
Mhm.
SQA that tells you this is what's happening this year? Be
Yeah.
aware, or like how do you keep with the changes? And how do you
So
understand all this information? Because
yeah.
honestly,
So
it's
we do get things from NCQA. So we belong to like the HEDIS users group, and they give us updates on things. So we get emails about that. We have a compliance administrative assistant who keeps track of all of the HPMS, CMS compliance issues. And so she forwards us things saying, hey, you need to take a look at this. And, this is coming out. And we have access to those areas as well. So if I just want to dive into the computer and get into NCQA, or if I want to get into HPMS, I can do that and see what's going on in there. I get tons of emails from HPMS about every little thing that's going on. And then I just kind of filter through those once a week or once every 2 weeks, depending on how busy I am, and weed out the ones that don't really have to do with me or my role. But there is a ton of information, and it is all over the place. It's hard to keep track of where everything is. I just like take copious notes. Like I just have a notebook next to me, and I'm always writing down notes on where to find things, and reaching out to people, networking in my own health plan, knowing who does what and who I can reach out to with questions. And it's a little bit different when you work from home because you're just reaching out from teams. And we do get together once a month for an all staff meeting. And so at those meetings, I try to like go and say hello to everybody in person, and just have some sort of a live relationship with them instead of just on Teams. But it's just leaning on people who can help you with things or put you in the right direction. If they're not the person that can help you, they, might be like, oh, I know so-and-so did this, and so reach out to him or her. And that's been really helpful, actually, is kind of just building up my network of people who can assist me with things and point me in the right direction.
Do you ever network with other executives from other health plans? Like, did you? I know that you've been on conferences, of course, but
Yeah.
Conference speak is always superficial, right? Like you say hello, you may have a conversation, but it doesn't really get in depth into the challenges that you may have.
Yeah, I haven't yet, only because I still feel kind of newish to the health plan. But when I was in the healthcare field, I definitely did.
Mhm.
Having been in there, since '95. So I came over here in 2022. So I still actually have a lot of my contacts at the health system because our insurance, our health plan, is actually under the umbrella of that health system. We don't own, it's not an HMO to the point where we only contract with that hospital or that med group. We have others in Southern Nevada and all through Nevada. We are a regional health plan, however. And so a lot of what we have a very unique program. And so not everybody has the benefits that we have, yet we don't have all the benefits that a full-on HMO, fully integrated health plan like Kaiser has. And so we kind of have both, both the hardships of a nationwide or a large health plan, trying to get a hold of doctors in other areas of the state, trying to integrate ourselves into their lives so that they're willing to help us close care gaps and complete those quality measures. And so, but then again, we also have a full, very large health system at our disposal that works with us closely, and they're easy to get a hold of, right? Because we just reach out to their medical director and talk to them, and we speak to them at least once a month. And so it's much different than we call them the community providers. So those ones, at least with our health system, that's probably about 80% of our members. So a lot of our members. And then the other 20% are these community providers. But we still really try to support them and help guide them. And even if it doesn't have to do with just our members, but they're struggling with Medicare Advantage as a whole, because they have several Medicare Advantage plans that come to see them, we'll still try to help them and explain things to them and that sort of stuff, because we're local and we really pride ourselves on being like local to the Reno area, Reno, Carson, Sparks. And so we're willing to like go to their offices and talk to them in person. And so a lot of the big ones, of course, like United Healthcare, Humana, they don't come to their office and help, help take care of them. So
all the ways to reach providers in person. So it sounds like a great community there in Reno that you guys have built. It sounds also very involved. So what does your day look like? Like a regular day for Jacie at work, what does it look like for you?
So right now we're going for our NCQA accreditation. So it's like all about collecting, like developing program descriptions, program evaluations, program roadmaps, work plans. And so it's all about that. And also we are implementing a new HEDIS vendor. And so there's a lot of work with that. So pretty much every day I just come in and I have my little to-do list, which I love to-do lists because I love to check things off. And so I make out my to-do list, which usually has at least 10 or so items on it. During my downtime, I always make sure on my calendar that I block out time for my own work. On Monday mornings, I come in and look at my week ahead. And if there's still space available, then I block it for myself, or else somebody will take it with meetings, and they're not always meetings that I feel like I need to be on. It's just kind of a waste of time. And then I find myself multitasking, which is not good, because you're not focused, So a typical day is just trying to balance my own work with these meetings and prioritizing my day with my to-do list. It's pretty much the same thing every day. Sometimes new things come in, sometimes like new deadlines come in. There's always those things where it's like urgent. We need this done by the end of the day or the end of the week. And so then everything kind of goes to the wayside while that thing gets prioritized. I'm very much in the weeds with my team. I am the manager, but I'm also a nurse. So we have 2 nurses on our team. We have a very small team. And so when she's gone, I do her nursing stuff. So I do the quality of care investigations. I do the emergency room follow-up calls. That's one of the HEDIS measures. We decided to take that on because we are nurses and we're able to do that. And we work in the EMR, the same EMR that our health system does. And so we just
this is a very broad set of responsibilities from doing the emergency room follow-ups to implementing a new HEDIS vendor.
So it's a lot. So I do get to flex my nursing brain muscles every now and then, which is good. And then we also have another program that's underneath us. We call it our Comprehensive Health Assessment Program. And so as a health plan, we've rented space at some clinics around, which are part of the renowned health system. So we're part of that. But we have hired our own providers and our own medical assistants. And I was like the supervisor of that up until recently. And then we hired a supervisor, but that's a whole like clinic program. Like they do basically annual wellness visits all day, every day. and risk adjustment. So they collect risk adjusting diagnoses and things. And so it's a good way for us to make money off those risk adjusting diagnoses, but also have that face-to-face relationship with our members as well that come in for those appointments.
Right. Primarily, I think you guys, what you do is great because you have such a close relationship with your members, right?
Yeah. I mean, literally, they just walk into our office in Reno, and they know the girls at the front desk. And when we're in the clinics, we all have hometown health badges. We don't have renown badges, so they can see right off that we work for hometown health, which is under renown. But they know that is their insurance, right?
Yeah,
so
I love that. I think from other guests also their experience themselves in helping as members, as patients.
We have very invested teammates on our team. Like, we're very invested in member experience and member healthcare. And so everything that we do has that member's experience, health in mind. So we don't like to we take into account when they're like, you're calling too much, or, I don't need any more outreach calls, blah, blah, blah. We take that to heart and try to improve on it. How do we get in touch with these people without, several different departments doing it at the same time? How do we consolidate that and make it more meaningful and not an irritation?
Yeah. I have a question. When we were regarding patient or member outreach, right, and getting that information, you mentioned when they say no more calls, like you take that information. There was a moment during the conference when we were talking about organic data points that health plans have from members. For example, members may say like, well, I just don't eat very well, or something that hints to, for example, food insecurity or risks for dementia and all of that. Like some data points about the member that perhaps are not so easy to capture, right? Because we're not talking about the member fell. We're talking about the member is not eating well. So right. It's difficult to sort of put in a box. Are you capturing those kinds of data points, and how do you go about it?
We definitely use social determinants of health questions. And so there are so many of those, but we do right now concentrate on the ones that HEDIS is looking at. So financial resource strain, food insecurity, housing stability. Those are the three main ones. And transportation, the four main ones. So we do keep our ears open for those things, and we train to that. So like if you hear somebody saying, I can't afford, more than 2 cans of soup a day or something, right? Or I'm sad and I'm not eating well. My husband died and I just don't have an appetite anymore, sort of thing. And so it comes down to just digging in deeper with those members when you're talking to them. Customer service doesn't do it quite so much. They haven't been trained to that level. But we do have, for our Medicare Advantage plan, if they have a renowned provider, which almost all of them do, we have what's called Senior Care Plus Personal Assistance. And you can talk to them and get them appointments. They can reach out to case management or social work for them to contact them. I can do the same thing, like with the ER follow-ups. I have contacted Hometown Health social work and said, hey, this person's going through this and they're not sure what to do. And she'll call them and talk to them. And so it's just really, like I said, it's a really pretty tight work environment. And then also we're pretty close with our members as well. Now that we're doing NCQA, we're expanding that member outreach or like touching base with them to our commercial population, which is a bit of a learning curve too, because these are typically maybe not healthy, but independent people, right? They're still working. They're trying to raise their families, possibly their parents still, and so they don't have quite the amount of time to sit and chat with us. And so we have to be very specific on what we're outreaching and try to have some verbiage that is engaging to them so that they want to participate or they want to go to the doctor or get those screenings done.
Yeah. I mean, I can see the challenge.
Yeah, it's definitely. Yeah.
Well, thank you for that overview. I mean, you're doing so much. You're doing so many jobs. I feel like you have a lot of experience in many different areas. I want to ask a question around, as a woman in healthcare, are there any unique challenges or lessons you like to share with us? Like anything?
Yeah, I think there's been some interesting ones since I've been a leader. I find I really want to help women support women. And I noticed that some of my women leaders are, they say a lot of the same things like men have said or used to say, like, oh, you need to control your emotions, or you need to, that sort of thing, when you're trying to get your point across and you get a little, heated. And
we're human beings.
Exactly. And then, afterward, they're like, oh, you probably should have really controlled your emotions. Or they pick on like your clothes. Like I had a coworker that had an adorable pink suit. And like her leader was like, oh, that doesn't look professional. And I'm like, well, she's wearing a suit. She looks gorgeous. Yeah. So it's pink. You know what I mean? I mean, it's like, there's still a double standard there. Like men can wear tennis shoes with their suits, but women can't wear a pink suit. And so I struggle with that because I'm kind of a feminist, and I feel like can you just see me as a person and not as a girl or a woman? And I have that woman high voice, and I have bangs, and so I sometimes don't get taken seriously, but I know a lot, and I am very logical. Like I think about things logically, and I am methodical, and so I'm never like do things hastily or rashly, and I would like to be recognized for that more often than, oh, your voice got a little screechy towards the end there because you were passionate. You
care about your job.
Yeah, I do. And so those are the things as a woman that I've noticed that probably a lot of women have noticed, and we have been working to decrease that. But I notice, men have kind of backed off that, but women are still pointing that stuff out. And it's like, give me some real feedback. Not that my suit was too pink. Whatever.
We haven't been pressured to support other women as much as men have been pressured for women. And yes, I think women need to support women. The good news is I've heard something similar from other guests and other people in the industry, like we need to support more women. And I think, we are realizing, yes, we also need to be more open to supporting other women. And by supporting, I mean, like you say, respecting first the individuality, right? Like we all different. If he gets a little heated, we're passionate about our job.
Exactly.
I always see healthcare differently, right? Like more so on your side, you have responsibility over care of a member that you are calling to follow up after emergency room discharge. So you have some passion in there for what you do. You're a nurse, so obviously you're going to be passionate about your work and what you do,
right?
And other people should take that in consideration and actually celebrate it, right? It would be bad if you were like, okay, well, I don't care.
Yeah, Yeah, I mean, I definitely do care. And so I just like, so when I'm leading, like when I am speaking or I am asked to like sit in a little audience in front of my other female workers who are practicing speeches and whatnot or presentations, I try to focus on like real things like, oh, you used a lot of acronyms. Our members aren't going to understand that. Try to stay away from acronyms. Or, you talked really fast, maybe you slow it down a little bit. Like I feel like I'm giving and I'm trying to give like useful feedback.
Right.
Like, don't wear that, your cleavage is showing, what, you know what I mean? Like that takes like the primary focus sometimes from some of my female cohorts. And right. It's like, really, we need to concentrate on what she is talking about. And help her with that. And then, you can probably throw out, if you think that they're not dressed appropriately or whatever, just make sure you dress business casual or business like or whatever, and not call out specific pieces of their body, like your eyelashes are too thick or your.
Unfortunately, it's kind of part of the job.
Yeah.
But I think, to your point, I think we need to be focused less on that and more on the content, right? Like
yeah.
Saying more about the essence of what you're trying to get across, and how do you present it to make sure people understand it.
Right.
Sometimes we are in sessions where people are just reading whatever.
Oh, that's painful.
Yeah. And I was like, wow, this is not great. So
Mm-hmm.
I don't remember how she looked like. I do remember that she was reading from a slide. Right?
Yeah, and that's hard too, because like when I was in school, I had a presentation class, and it was all about don't do death by PowerPoint, and just like put pictures and graphs and things in your PowerPoint slides and then speak to them and make people take notes. Or you can share your slides at the end with your notes in the notes field, right? But don't read your slide verbatim. And that's one of my pet peeves. But that's why I liked when presenting on a panel, because it was just kind of freestyle.
Well, thank you for sharing that. I think it's a very honest view of your challenge, right, as a professional woman in healthcare, and I appreciate your being so candid and open with us. What excites you more about the future of healthcare? Like what in your area of expertise or other areas?
I would like I'm all for government regulation on things and driving best practices and monitoring that. So I would like to see our relationships with providers get stronger, and for them to understand more about the insurance companies and regulations. So we work really closely with our med school here, the University of Nevada, the Reno Med School. And we're trying to kind of get our feet in there so that our senior leadership, the physicians, can get in there and teach a little bit about coding, about regulations, about things that really matter to providers that they don't learn about in med school. Mm. And they don't really learn about it after med school, except for just piecemeal. And so it makes a barrier, right? They're like, well, you want me to practice cookbook medicine and, that sort of stuff. And you hear it all the time. And my comeback to them is like, if you were trying to cook a souffle, wouldn't you use a cookbook so that souffle turned out the way that everybody expected it to, including yourself? So I look at healthcare the same way. Like, we need a cookbook. Everybody should be doing certain things the same way, which is the best way, right? Like, so those best practices. And so I try to tell them, like, we're not trying to control the way you do your work. We're trying to lead you the way to do it in the best way.
To align. So I think people don't understand what health plans do or ask what they ask, right? Like
or regulate, or even like CMS, like they don't understand why they're asking them to make sure everybody has a colonoscopy, or make sure that we're screening them for lung cancer if they were a smoker, or for abdominal aortic aneurysm, or these things that can turn out horrible for people. And it's as easy as a screening, right? An ultrasound or an x-ray or a CT scan or something like that. Mm-hmm. And yes, we tell you about it. And yes, sometimes, with MIPS and stuff, you can get fined, if you're not doing your due diligence, or you can't see Medicare patients anymore, or whatever. And so there is a reason for all of that. And it isn't about control.
Right.
It's about the members. It's about the patients. It's about the whole country, having a not super sick population, because we're doing our due diligence to try to keep people healthy. Yeah.
For that, Jacie, I do appreciate all of your insights. I think that's a great, view of the future, more alignment between providers and health plans, and overall the healthcare system. So hopefully we can all work together to make it happen. Again, thank you so much for joining us today. I've enjoyed this conversation a lot, so I'm so glad that we had the chance to talk today. So thank you, and thank you to our viewers for watching the episode today. Again, for more episodes, follow S2M Health to get them on your feed. And until next time.